Hey friends, it's John Gunzel here, coming to you on day, I guess this is 3 of my septoplasty and turbinate reduction surgery on my nose. I'm going off the painkillers today. See how that goes. Going to just be on some Tylenol. Nose has been pretty sore the last couple of days. I haven't really wanted to do anything touching it or messing with it as much as possible, but I have been doing the saline washes about 5 or 6 times a day, keeping it coated with Vaseline, and I'm getting to the point now where I think I may have actually acquired a sinus infection or a cold during the middle of this, which isn't really fair because I started to recover and get a little bit better, and now I'm all stuffed up with snot and stuff again. So sometimes that happens, I guess. I get a little bit unlucky on the timing, but it's still pretty sore, especially like right here at the base of my nose, my teeth, and up top. But you can watch the other videos and kind of get a feel for how I went through that part of it. The good news is it's not draining anymore, so I don't have to wear the mustache bandage. But I wanted to take a minute and show you some of the things that I used to help me get through this surgery and the recovery especially, that are things that I wish somebody would have told me ahead of time to have here and have prepared and be ready to use so that it would make things go a little bit earlier. So I'm going to switch over here and walk you through a couple of things that helped me along the way, so hopefully they'll help you too, okay? Okay, so one of the first things that is critical is some kind of a neti pot or rhino horn. I'll show you how I use that here in a second, but super critical for washing your nose out, getting all the blood and mucus and stuff, the clots to come out and come through. Trina found these for me, these pre-mixed packets of saline, and I'll show you they're just a little bag of these little guys. And what you do is you just tear the end off it. It's real easy to tear the end off. I put it right in the main hole there, just pour it in. And then a cup of distilled water is what I'm using. What I figured out is that if I take my jug of distilled water here, and I'll fill that cup full, and I put it in the microwave for 30 seconds. Make sure you use a thermometer and find out. Your microwave might be different. But for mine, 30 seconds gets it up to 100 degrees. Which is just absolutely perfect temperature to run through the rhino horn. So then I pour it in there. It mixes up really easy. And then I just run the rhino horn through my nose. And so to show you how that works, I'm not going to actually do it right now, but you just take the end of this. Take the end, put it in your nose and tilt your head to the side. And what happens is the water runs up, it goes through your sinuses, comes back down around and runs out the other side clear. And so I do that a couple of times each way to make that work. Got the petroleum jelly here and the Q-tips for just going inside the nose, making it nice and smooth and clean. And those are really the main things that I've needed to keep it going. Of course, lots of Kleenex and lots of patience. So that's really it. Rinse 5-6 times a day. They say as often as you think about it is probably about the right frequency. So I've done that a lot, and the nose seems to be healing. Can't wait for the rest of the recovery to happen when I can actually breathe out of the thing again, because I haven't been able to breathe or blow it or anything like that. Closest I can do to blowing my nose is just doing the rhino horn I just showed you. But especially now that I think I have a cold, it's been pretty rough not to be able to blow my nose. But I'll survive it, I'll get through it, and I'll give you an update. I'm going in Tuesday to go to the doctor to get him to do the post-op check and clean anything out, and we'll see what kind of status updates we have by then. Hopefully I'll be breathing better. So that's it for this part of the journey. Thanks for joining me. Keep in touch, and we'll talk to you later.